Hello, this is a Colorado Black Health Collaborative volunteer orientation for 2022. We've had so many requests and we've already given some of these sessions with participants, but we're getting so many requests. We decided to videotape this and give you some options at the end, just because there's so many, and Tracy and I have been doing our best to keep up with the membership and orienting our new volunteers, because volunteers are priceless and we want you to continue with us. So today we'll be talking about welcoming you all, a little bit about CBHC and overview, committee work, projects and activities, volunteer opportunities, and we always talk about sustainability. So we start with the birth of CBHC. That's what we call it. Back in 2008, the Colorado Department of Public Health and Environment wanted to share health disparities data. So they came to a group of people in the Black community and said, hey, can you guys plan an event, a cultural event, where we can talk about some serious business about the disparities in the community. And so we thought the family reunion would be very familiar for our community and would be a great way to, have some fun, but also talk about some serious issues in the community. So we really engaged the community in healthy conversations. At the beginning of this, we had food, fun, and networking, just like a real family reunion. But we had the town hall in the second half of that, where we really did engage the community in healthy conversation. The conversation was frank. People continued to network even during this session. And people asked, hey, are we going to continue this process? They said they were tired of state health coming out, writing up their reports and going home. And we said, if you all will become partners with us, then we will continue the process and try to come up with some solutions for what was going on. So this was by the people, for the people. And really the community wanted to continue the process, and 3 months later, the community came through and we developed CBHC, which we'll talk about our mission and all of that. But CBHC became a collaborative network of healthcare professionals, providers, community advocates, public and private healthcare organizations, as well as individual grassroots community members committed to the equitable distribution of health resources to the Black community through culturally sensitive networking, health education, and enabling access to information and resources which target the Black African-American community. And so CBHC, that 3 months after that first event, we came together. We initially had a 3-paragraph mission statement, and the community people said, this won't do. That's too long. You need something that can roll off people's tongues and is much briefer than what we were initially thinking about. So we came up with the mission of to achieve health equity in Colorado's Black community. And we had a bit of discussion about whether it should be African-American / African, just Black. And we came around to describing ourselves or naming ourselves Colorado Black Health Collaborative, because we wanted to include the entire Black African diaspora. And we thought that Black Collaborative would be the way to capture that. And we said Colorado, because although we concentrate as Black people in the urban areas, Denver, Aurora, Colorado Springs, we do know that there are other Blacks across the state, and we wanted to be very inclusive. The logo that you see on the right was designed by a student that was volunteering and working at the Colorado Department of Public Health and Environment. He loved what we were doing, and he said, this is what I felt in working with you all. And so this is a Ghanaian symbol that stands for help me and let me help you. And we still use that logo from all the way back in 2008. And then we've developed some other models along the way. One of the things that we say a lot and kind of stamp on our paperwork is just for the health of it. We're doing this just for the health of it. So that's our mission. And what are our overarching areas of focus? Collaboration, These are the 6 C's, people: collaboration, cultural competency. And we know competency is kind of an old word, but it's easy to say CC, but you can say cultural, and then they've said proficiency, responsiveness, a bunch of things. We know that we want to make sure that everything we do, we're considering the cultural aspects of being Black in America, being Black, period. So we take all that into account. Community engagement and involvement. We want to engage the community, but make sure they're being involved. Community education, that is a key feature of what we always try to do, is educate people on the common and the uncommon. There's a lot of elements of health, which we'll talk about a little later. It's not just about diabetes and hypertension. There's also the social determinants of health. So we need to educate people on a lot of different aspects of healthiness. Community empowerment, and that's really important for us. And then covering all life cycles from cradle to grave. We want to leave that open, so if opportunities come up that involves the Black community, we can get engaged with that, rather than saying, well, we only deal with teenagers, or we only deal with seniors. We deal with all of it from cradle to grave. And then our organizational structure, this is important for people to know. From 2008 until now, we've operated with a board of directors and committee chairs. Primarily, we've had some employees on programs. We only have employees for our menthol project, which we'll talk about later, and administrative support is also programmatic through the menthol project. We are happy to say that this year we are reaching out and expanding. We feel like we've got to get further up the hill. We've come a long way since 2008, but we have not had an executive director, but this is in the works. We have put the job description out on Indeed, and working with the Colorado Nonprofit Association, put it on their site as well. So we're hoping to have someone sometime after the first quarter of this year. And that's going to be exciting because we are really still doing lots of great work. It'd be great to have someone in that role. And our current board of directors, we have Belma Craig as the chairperson. I'm the vice chair. We have Christina Yabua, who's our secretary. It was great. Christina was a public health student that did a capstone project with us and really examined CBHC. So it's great to have her come on board and kind of stick with us. Tanisha Mans Davis is our volunteer treasurer, but she is an accountant. We have Tracy Randall that works with blackdoctor.org, an online health-oriented informational, I don't know if you call it document magazine, but that's Tracy Randall. Adriana Hervey works with the Colorado Department of Public Health and Environment. We have Courtney Brown, who's a process specialist and businessman. We have Dr. Gandhi, who is a medical doctor, internal medicine doctor. And we have John Davis, who is actually an advisory board member. He's our financial advisor. He is a CPA, so an accountant, an attorney, and works for the IRS. He has special permission to work with us. And that's so wonderful because we can get all of our questions answered. And we also at times, though the person's not on our board, if we have some heavy duty financial issues or concerns, we have a consultant there that works with us for that. These are just some of our committees here. Our planning and evaluation committee is a committee that is responsible for planning a lot of our forums and special events. We have the Health Access Committee, who works with the Barbershop Salon program, which we'll talk a little bit more about that, and other health-oriented mini health fairs and educational sessions around various disease states. The Education Committee, this is a committee that is been on hold a little bit, but here recently, we are partnering with Denver Public Schools to try to do some health panels to really get the students oriented with the different health professions. We're not making it just the doctor, nurse, but even doing IT, health IT, information technology. ancillary services such as radiology, pharmacy, a lot of different medical oriented fields. And then membership, as I mentioned earlier, Tracy and I are serving in that role. If someone would like to take that over, that's great. We can give you the template on what to do. And this is something new that we're trying here, just to try to streamline and cut down on some of the hours that we have to spend on when we're doing this group by group or person by person. And so we're going to talk about CBHC projects. And, you know, we, as I've said, we haven't really had a lot of staff. We depend a lot on our volunteers, and we have those expansive areas we're covering from cradle to grave. So we, at one point, thought, what are we doing? We thought this quote was just so appropriate. The ones who are crazy enough to think they can change the world are the ones that do. So we keep trying to be active in the space of health for our community. So to tell you a little bit about our base programs, and depicted up there in the right upper corner is our barbershop salon program. That's from a few years ago. That was at our diabetes station. But the first program I want to talk about is the Tackling Menthol in the Black Community. And I'm not sure if you all know about the history of menthol in the Black community. Back in 1950, only about 5% of Blacks smoked menthol and like 2% of white. And the tobacco company said, whoa, Black people sure like menthol. So with some scientific engineering and just sinister marketing, they were able to have focused campaigns on the Black community such that it is now baked into our consciousness. And some people try to say that it's part of Black culture, but we were led to smoke these cigarettes by the manipulative marketing. Ebony and Jet used to have lots of tobacco ads. And so now we can say that we have Black men have some of the highest rates of lung cancer. And so one of our major projects has been to try to educate the community on the issue. We were involved with the Denver flavor ban, which the council voted in 8-4, I believe, or 8-3, but the mayor vetoed that. So there's some additional efforts at the state level, which we are watching carefully, and we are continuing to build our coalition and do education so that people really know that menthol really does impact our community. It affects other communities as well. And some of the same practices that the tobacco company used for menthol or the combustible cigarettes and menthol, they've kind of used some of the same tactics in the e-cigarettes. And menthol and mint are some of the top flavors for e-cigarettes. And just flavors in general are just more attractive. Menthol in particular, it makes it much easier to start smoking, harder to quit. And so it allows people to take deep inhalation. So that's one of our major projects. We periodically have forums, educational events. We try to make these real cultural. Like we would, one time we had a men's health event, and I can't remember the title of that one, but we women dressed in Black and we served the men. That was their special day. We even had a special line dance that was developed by Mr. Charles for them. We had a virtual, we had someone come and talk about virtual reality used in the health arena, and we were able to demo some of that. We were able to go up an elevator and either jump or fly off a roof. And they use that for people that have various phobias. So it was really pretty interesting. We try to do a lot of different things that address the issues that we need to hear more about and learn about, but do it in innovative ways. So it's not just the same somebody standing up and giving a lecture. And then our barbershop salon program, this is our 10th year. We're proud to say February is our birthday for that program. We started in 2012, and we basically, it's a volunteer program. We've screened over 8,600 people for blood pressure, hypertension, since we started the program in 2012. And we basically screen, educate, and refer people with that. We also have incorporated some other things. Just before the pandemic hit, we were starting to do some mobile HIV screening. We're working on a mental health project right now with the barbershop program, and there's different components to that as well. And you don't have to be a health professional to be part of that program. Education and mentorship. We're going to try to adopt a school. That's kind of aspirational right now, but we do a fair amount of mentoring. We've had students at every level, well, not elementary, but from high school, college, professional schools, do internships or come and do projects with us. And we also try to mentor some of the students that reach out to us. We don't advertise as much because we don't have a lot of capacity. We have a women's program that's kind of in the developmental stage. And that's a popular one for people to get engaged with. Women's health is very important. As Black women, all women, we've been working on getting to the point where we can take care of ourselves and we can be mothers, but still trying to take care of ourselves. And the women's program, they're going to be interested in doing some podcasts. Some of our programs, we did a lot of COVID work in 2021. We're still doing some of that. We kind of have a speakers bureau where people will go out in the community and speak about COVID and the vaccine. We've done quite a few shop visitations. We've had communication campaigns around COVID, both on social media, radio, Spotify. We volunteered at vaccination clinics. We've also been ambassadors at the governor's bus, just so people can see someone that looks like them in these spaces to say, hey, it's okay, here's some of your trusted partners in health. And so we were proud to be able to do all that. We're still doing a bit of that. We did a whole lot last year, went to a lot of different events. This year is not quite as hectic, but as I say, we are still doing some of that work. We write articles for our website as well. For the Tackling Menthol in the Black Community Coalition, and that coalition is being educated, they're being supportive. They, when we are able to participate in the flavor bans, our coalition has really been activated. Student mentoring, as I mentioned, we have this racism and civic engagement project where we had 9 house leads, and they led chats. And we said house, but it was all virtual. But it was on the model of, groups getting together, kind of a small, intimate group. We had no more than 10 people in the group. And just discussing, last year was about what are some of the things that we're seeing in our community around racism, the impact of that on Black people, the impact on the participants of this personally. And ultimately, we want to drive that project to civic engagement. It's good. I mean, people really felt good about being able to share some of the things they were feeling about racism, especially after all the stuff that happened last year. And so this year, we're going to have a recap of what happened last year, and then what do people think we can do to move forward? We can do a lot as a community and working together. We have resource directories. We call that a program because we have people reaching out to us all the time to ask where they can find a doctor, a dentist, a mental health therapist, just all sorts of requests. And we had a hard copy resource directory. It's about a couple of years old now. We don't have any more of those. We do have that same directory online, but like I said, it's a couple of years old, and post-pandemic, things probably have changed. So we do want to try to get that updated. But nevertheless, we do our best to try to get people connected to the resources that they see in the guides. We have on our main website that resource directory. We also have on our microsite, which is focused on COVID. We also have some resources there as well. And it's all sorts of resources. And people call us, we kind of direct them where our guides are, but also help them. And they give us feedback. People have said it was very helpful to be able to go and find out where some congruent providers are, some people that look like them, maybe some trusted people that they can connect with. We also have this Health Ministries Toolkit. And while we are not extremely active in that, we have these beautiful toolkit guide on how churches and ministries can work to get the health of their congregation together and their programming very organized so that you can help the people. And during one of our recent orientations, a couple of the people in that group really wanted to get this toolkit so that they can work with their churches and groups with that. And so, we can meet people in the office, give you a copy of this ministry. Is really well done. It can really give you some great direction. And we completed that a couple of years ago as well, 2 or 3 years ago. And people have really thought that that was beneficial. So those are some of our programs. These are some of the current volunteer opportunities. And I do want to slow down a bit. I think I've gone slower than usual because, without having an audience, it's very difficult to know how you're connecting and how fast or slow you're going. But I'm going to go a little slower on this page just so people can see what some of the current volunteer opportunities are. There's always writing articles for the website, which these articles usually roll over to Facebook if they're on our main website. Our main website, you can write just about anything. Our secondary website is a microsite called Flow Denver, where we focus in mostly on COVID. When COVID is done, we're going to remorph it back to our cardiovascular site. That's what it was in the past. But we also have like a document that talks about how to write in the inverted pyramid fashion. People don't like to read a whole lot these days, but so you'll try to put the most important information at the top and then just drill down and try to make it interesting. Think about yourself as a lay person on a topic. What would you like to know? We also have a section on our main website that's neighborhood stories. So, and we've had some volunteers that say, hey, I met this lady, has a great story. This guy has a great story. And they will write that up and we'll put it in that section. Committee participation. I named some of the committees, the membership, the planning, committees, the health access. These are all, you can participate on any of those committees. We also have the B chart, which is again a specialized committee for COVID. It stands for Black Community Health Awareness Response Team. This committee is going to have a special forum March 10th, 2022 at 6 p.m. We'll be sending that out soon. And it will be a forum talking about people getting the vaccine and what they thought about that, a recap of what's happened with COVID, and then just a bit of discussion on that. And tackling menthol in the Black community, the opportunities there to be part of the coalition, to learn about, we have like a standard PowerPoint, but to learn about the issue of menthol, the marketing, vaping in the young people, how it impacts the Black community, learning about that and doing presentations in the community for maybe some of the people groups that but certainly we have a list of people that we're going to be reaching out to. Some have requested presentations already, but we need to have groups of people that feel comfortable in presenting this and getting to know about this. That'd be great because people are tired of hearing from me. So, and some of our other volunteers that have been doing this. And so posting on our CBHC Facebook group, we have a main Colorado Black Health Collaborative Facebook page, but we also have a group. And once you join as a member of that group, you can post just about anything. We've witnessed that, and sometimes we've had to post just to try to keep other people's content down. Helping us identify resources or either verifying some of the resources that we have. Grant writing, identifying grants and writing grants. We've done a bit of that over the years, and there's a lot going on. So that's just another area where if somebody has those skills, that's great. Identifying grants and writing grants, or if you can't identify them, if you don't mind writing them, that's great. COVID-19 related, we always have kind of ad hoc stuff going on with that. We are doing some COVID education in shops. We're going to some specialty events, so that's always available. We can't always predict the COVID related events that we're going to go to, because people reach out to us. But we always try to be ready to have some volunteers that say, hey, if something comes up, I'd like to participate there. The educational connections, we're really going to try hard this year to adopt a school. And we're thinking about some strategies. The schools are very busy with COVID and all the stuff that's going on, so they can't as easily connect with us. So we're thinking of some strategies to just kind of put a toe in the door, go by and deliver some goodies, find out what they need and want, and then deliver that. And then perhaps that'll get us a toe in the door, and we can do more with them as we move along. The barbershop salon program has kind of been on hold. And the full name is the Black Barbershop Beauty Salon, or a Black Barbershop Salon Health Outreach Program, because we do more than just screen, we do the education as well. It's been kind of on hold due to COVID. We have gone on there and had a few COVID conversations, but we have not been doing our blood pressure checks as we had done. We tried not to stay in the shops as much because they're very small spaces, but we're right in the midst of bringing this program back up. We train all the volunteers, and then we usually have 2 people go into the shops. Right now we have about 15 shops, so every Saturday somebody's going to a shop once we're fully up to speed. And I always put other ideas here, because as a volunteer, new volunteer, you may have something you've been burning to do your entire life and never had anybody listen to you or let you do this project. If you have a great project idea, we'll help you cultivate it. The barbershop salon was brought to us by Dr. Connor. In 3 years, he and his wife had screened about 45 people. That's all they had the time to do. And you see, we're up to over 8,600. He brought that to us, and we said, let's kind of keep tweaking it and working it. We got more shops, we got more volunteers, and thus we are where we are today. So a seed can grow into a tree. And that's what we always say about that particular program. But some of our other programs, even the B chart, we had community people coming to us. What are you guys doing around COVID? And we're like, we don't have time. We don't have time. People kept knocking at the door. So we said, okay, we formed this committee. We've had several special events for that. We did a whole bunch of COVID activities last year because we were in that space. That started as a seed as well. Somebody's idea that CBHC should get involved. And then, so you can determine where you fit in. Volunteers really play a crucial role in our success. I'm going to go back a slide and really kind of let you go one by one, writing articles for the website and Facebook. That's something that's easy to do. If you don't like to write, that's fine. But if you say, hey, I want to jump in and do something, that's one area. Committee participation, any of those committees that we talked about before. B chart is one, that's a COVID related. And we did talk about going back a bit ways, the planning, evaluation, health access, education, membership. Those are all things that you can get engaged in committee-wise. Tackling mental and the Black community, the coalition. The coalition meets every other month. And presentations, we train you on that. If you have a list of people that you think would like to know about it, great. And then posting on our Facebook group. We had a student that was doing this. She developed some polls. She developed some handouts. She discussed issues that she wanted to. Resources, if you want to work on that, we can get you going. Grants. That's something, if you are able to write grants, let us know that, because sometimes we have grants come our way, and nowadays we have to let some of them pass by. And the educational connections, the barbershop, other ideas. Before I move on to the near last slide, I did want to tell you about our websites that you can go to. And our main website is www.coloradoblackhealth.org. That's www.coloradoblackhealth.org. On that site, we have our tobacco page that has lots of videos, fact sheets. You can learn more about the menthol there. It's a nice page. We just released it this year. It's under resources. So that's our main website. There's also Some of our programs, the barbershop program is listed there. And then we have our microsite, which is www.flowdenver.org. And that has the CDC microsite for COVID. And we have a lot of we have articles and resources related to COVID. And we have just a little bit on the high blood pressure at this time on that microsite. So we have the 2 Facebook pages. We are also on Twitter. Please go and follow us on our Facebook. Even if you decide after today, hey, I don't really want to get engaged with them, go and like us on Facebook. Check us out on Twitter. We've got lots of great campaigns going on in those spaces. And so again, I said, volunteers play a crucial role in our success, and you can determine where you fit in. We think we can find something for everyone. So say, I don't know. If you think that you're interested, then just go back to our info@coloradoblackhealth.org and let us know, here's what I want to be engaged in. I want to do X, Y, or Z. I want to not do X, Y, or Z, but I want to give X, Y, or Z. So sustaining the effort. As nonprofits, we could never have enough money to pay everybody that we need to get everything done. And we know that it's going to take a while because achieving health equity in the Black community is a long-term process. It will not happen overnight. We said we started in 2008. That was in August of 2008. And so we believe, made some progress, but there's still a long way to go. We still have some of those gaps. And we know that it requires people, passion, commitment, energy, synergy, and some money. We used to have on here, if you can't do, then give. If you can't give, then do. So we have lots of opportunities for people here. And certainly, if you have any questions, I know it was only me here talking. I try to pretend there were some people around, but it was awfully difficult going through this without any people, because usually we have a good exchange and people are looking at me funny and that type of thing. But I didn't give you an opportunity to ask any questions. Now is your time to ask questions. Again, you can go to info@coloradoblackhealth.org to ask any questions, and also to say, hey, I want to raise my hand. I want to do that. And I've been trying to get some people to take over the Health Access Committee for a few years. So if you see some places where you want to step in and be the leader and take over, we're happy to have you do that. And so please drop us a line and let us know what you'd like to do and how you feel about all this. Thank you so much. I'm going to stop sharing here and say that we are just so appreciative that you reached out to connect with CBHC and potentially become a volunteer. If you decide you don't want to become a volunteer, we're not mad at you. But please, please let us know if you want to do something. We will get you to work for sure. Thank you for your time. Good night. I started in morning, now it's night.